talk to you about the just introducing you to the neonatal unit and cotside care. So it's lovely that we have, as we mentioned in the introduction session, that we've got everyone's described their different experiences and how long, how short they've been in the neonatal unit. But it is safe to say you have all stepped onto your units, yes? Yeah. So, as you have all stepped onto your units, I will share my presentation. Share. And just while that's loading, I want you to think about the just what your first experience was on your unit. We'll ask that question in a minute, but just start having a think of what your first day was like. And for some of you who had the first time ever stepping on a neonatal unit, and for some of you, first time on your new unit, how that felt to you. Okay, so what I hope for you to get out of this session, the learning outcomes that I sort of laid out, we hope that you have a better understanding of the unit. This in combination with the session that you've had before, we're hoping that you have a better understanding of, the whys of what you're doing on the unit. Just also have an understanding of the anxieties that, under stress, just have that awareness that the area itself can increase stress, can increase anxieties on the service users, and also have a better understanding of the importance of cotside care, and also the safety checks that we do on a day-to-day basis, and also have the that's those three things. I can go on from there. There's lots of things that we do. So if you talk to me think about your first day, your very first day on the unit. What did that feel like? Is anyone happy to share, or just unmute yourselves, or you can raise your hand, whichever feels right for you.
Quite overwhelmed, actually.
Yeah.
The very first day I walked in there. Yeah.
Yeah. What made you feel really overwhelmed? If you don't mind.
I wasn't actually sure, aware of how big it would be and how many babies would come to the units. So yeah, definitely. It was quite a full-on day, my first day. I remember quite vividly. So yeah.
That is important. That's quite a common actually feeling that a lot of people get. But yes, hold that thought, because we may just use that in further discussion as well. Anybody else willing to share? We can pop it in the chat. What was your first day like, just stepping onto the unit?
I felt it quite daunting because obviously I've never been on a neonatal unit before, but and I didn't want to feel like I was in the way as a new starter.
Yes, I think that's very important as well. Think of the students and even the parents. I think Teresa, you said it's a magical place. Oh, just lost it in the chat. And yes, that daunting feeling of just thinking, oh, I'm a spare piece here. I'll just be standing around. Where do I stand? Where is it going to be appropriate for me to not getting in the way? And Teresa, you said very different sounds and light that you came across. Yeah. Anybody else before I move on the presentation? And all these things are very valid, because I could definitely share with what Nick and Teresa and Julie have said. I felt all those things. Apprehensive, yes. Excited, yes. New trust, new people, absolutely. And there will be different families actually that will be experiencing that. So we'll talk more about this now. Thank you, all of you. So neonatal unit does bring you like a mixture of emotions, and families will have different reactions. So if we think about where our babies come from, where do our babies come from? Obviously, they come out of mums, but where are entry points from admission points? Where do we admit our babies from?
So labour ward, theatres.
Theatres, yeah.
Yeah. Where else do they come from?
Transitional care.
Yeah.
Other trusts.
Other trusts, yeah. Important. Very important. So, so when we think of yes, it's a place full of miracles. It's magical, and it's like no other place that you could ever work. But because of the noise, the smells sometimes of being, it doesn't have particularly a hospital smell, but some hospitals do have that, really hospital smell, but some hospitals don't. And just the feeling of being in a place that's got alarms ringing, there's that sense of urgency, but people seemingly being calm and walking around calm can be quite confusing for the families that are coming into that place. And I think even for yourselves, when you first came in, we're like, oh, shouldn't we be? I mean, for those of you who are adult nurses, when you first saw your first baby having a bradycardia or a desaturation, seeing SATs drop down to 60 and there's no cardiac arrest team being called, how did that feel for you? You're probably jumping up and down and thinking, do something. But staff, parents and staff, we will feel the same emotions when we walk onto the neonatal unit. So especially how you feel, and Megan, you've mentioned that you were apprehensive, you had the nerves, just not knowing what you need to do. And parents will feel exactly the same way. There are some videos that the foundation that has created, NICU Foundation, and I will share the animated guide just at the end of the presentation. So I'll do the presentation first, and then I'll share the 2 videos that I've got for you. And these start talking about first what we say to parents, how we make them feel comfortable, that orientation, that is very important. And then there's another video in there that talks about the babies that come from home, come from another trust. The same things that you are feeling that you would feel if you're a new member of staff coming to a new trust, a new ward, new team of people. You knew what your systems were. If a parent has been, say they've been at a level 3 hospital and having this intensive care, when they're coming back and being repatriated to their home hospital, there's a lot of worry that comes in, because they might feel, well, does the team know what to do? Will I feel, I've just gotten to know the team that's been looking after my baby. I like the nurses here. I know where I sit. I know how to control my emotions. I know there's some people who, because of the stress of having the preterm baby, they do things in a certain way. You might not realize it, but when you have the deeper conversations, it can really affect people's mental health. So maybe they say, I take 4 steps down this corridor, and then I move to the left, to the left side of the corridor, and then I sit in this chair, and that's how I cope with being on the neonatal unit. So changing the unit can be very, very daunting for some families. So we'll talk about some of the things that we need to do that will make them feel a lot more comfortable. And the most important thing for us is induction. I suppose when we start on the unit, I'm sure you all remember on your first day or your first couple of weeks, you had somebody show you where fire exits were. They showed you where the coffee room was. They showed you where to put your bag. Where the cloakroom was, where you could get changed. To wear your uniform. You learned more about how to access the policies and procedures. You were then given passwords to use the computers. your bajonet, and you're then given mandatory training, which then further opened up, that feeling of you having that feeling of being comfortable. What similar things can we do for families which are similar to induction?
Exactly the same, really. A show around the unit.
Yeah.
Show them all the important places around their baby and talk to them about how days should progress, but they don't always progress the same way.
Yeah, absolutely. And the key things that they'll want to know is my baby okay? What can I do? And if they haven't been updated, when can they speak to a doctor? And if there's food as well, because when you're really worried, do you actually remember to eat? Some people do. But so parents will need to be reminded. I mean, some of them will be like, "Oh, you have to keep reminding them that you can get a drink from here. There's a drink fountain here. You can make tea or coffee here, or you might just if your unit orders meals, make sure you order them a meal, and just make sure they eat as well. Because if we're hungry and we're extremely tired because of stress, the less likely we're going to concentrate. And it is we know ourselves when we get it's more it's hangry, we call it, isn't it? Where we get you get more agitated as you get hungry. And you've got less patience. So if somebody then starts telling you lots of explanations about your child's care, and you've not eaten, you've not slept, what happens to the information that you're giving?
That doesn't get them.
Yes.
It was muted. Yeah, right over
Yeah.
Yeah.
I did see the hand movement, yes. Yes, it just goes right over the head. So has anybody experienced parents or families that will ask the same questions over and over again? And you probably say in handover, and they'll say, well, I'm sure I explained that to them. Well, I'm sure I just told them that. Oh, I told them that yesterday. Are they asking that again? Anyone experienced that sort of family?
Yes.
Yeah. I think we all have, and if you haven't yet, you will experience that. And that just goes to the stress of being in the environment, and it's just their way of trying to cope and just try. It could even be weeks down the line, and they'll feel guilty, and they'll keep apologizing for asking the same question again. Or sometimes they won't apologize; they'll just ask the question again because they've just totally forgotten that they knew the answer. It's just how they're coping with the situation. But the things that we can do is, include them in the care. This is why we always need to, include the families, make sure they know that they're partners in care. They're not visitors. They are partners in care. It's their baby that we are supporting them to look after. And once they know that we're there in a supportive role and their opinion matters, they will probably be more observant on what's happening with their baby than we will, because we, from shift to shift, we might have the same patients 2 days in a row, but if the baby's a couple of weeks old, these parents have had that baby to look at, and that baby that they've been focusing on, that they've been seeing grow, and they'll know when the baby feels well, the baby feels unwell. So their voice matters on what exactly they feel is happening to their baby. So listening to their worries is also important. If we can alleviate them, because sometimes it just might be them thinking of the worst case scenario and the baby's well. But if they think that the baby seems unwell, and listen carefully, because they could be right. So now moving on to cotside care. What sort of how does handover? Do we all do cotside handover in our units? After you all have been allocated your baby, you have handover by the cotside, yeah? You can see
Yes.
a few nods. Yeah. And so does somebody want to unmute themselves and tell me the process of their handover? What information are you handing over? I know I'm cheating with the slides there, but how does your handover go in your unit?
The baby's name, how many weeks it was born, and the corrected gestational age. If the baby was born by emergency cesarean cancer, can tell the reason, like poor CTG, like more of maternal cause, or the baby fact went for cesarean, like for fetal distress or for poor maternal effort. And then you can say what was done initially, rescue breath was given, ventilated, and now baby is on vapotherm. Respiratory wise, is still requiring oxygen, maintaining saturation with this much oxygen, and then whether any work of breathing is present, and then first the respiratory part, then the feeding. If the tummy is okay, it is distended, or how are they tolerating feeds, how many meals they are taking, then how do they look? If they are looking okay, like pink and perfused, and finish with the elimination, like baby passed urine, open bowel, and then to the medications, what they are on, like they are on antibiotics because they still have got some increased work of breathing, and
yeah, and that's nice and thorough. Thanks, Angeline.
thank you.
And I think that's important. Is there anything that Angeline said that any of the units add on, or what other things do you say?
Possibly what the plan is, what the plan will be going forward with Hope. Yeah.
Fantastic. Yeah.
What the ward round comments were.
Fabulous. Yeah. And also likes and dislikes. If you think, because sometimes it'd be useful for say if I'm taking over the baby that you've been looking after, Nick, it'd be useful for me to know if you tell me, well, it's been noted that this baby doesn't like to lay on this side and lays more on that side. If you position them this way, this is what they like or don't like. Or if they feed, they've got their own bottles. Or when we fed them, we fed them with a slow teat because they've been able to cope with it better, or they feed better side lying. So those things are also very useful, so we can have a steady continuity from one shift to the next. Fantastic, Teresa. You've just said about family involvement as well. If they're rooming in, that's also very useful when you're handing over. Because it'd be terrible if if the person that you've handed over to doesn't know that the family is coming in and they go ahead and feed the baby, and the parents yes, and they go ahead and feed, and then the parents turn up and find that the baby's already been fed. Okay, so move on to the next one. So we seem to have nicely covered that. So, seems to have to go backwards on my slides. Okay, so for health, so this is all part of your health and safety. Alongside that, the things that we want you to be doing when you get to the cotside is, check for clear identification, as Rachel mentioned in her previous presentation. Check that the baby has their ID bands. Do they have their cot card? Do you have their weight documented appropriately? Are their fluids correct? Are they according to the weight? You're checking your drug charts as well, making sure that medication that was due to be given has been given when you're handing over. And you also know, as the nurse taking over, that as that shift continues, I know exactly what medications I need to give when. Everybody has a different way of trying to remember this information. I like to indicate it on my observation charts. I'll put little symbols, I put little M's to say when I'm doing my obs, at this point, this baby's got medication due, so I'm not going to forget that. But everybody does it differently. So by no means telling you to do it my way. And you check your emergency equipment as well. So some of you might use neopuffs, some of you will use bag and valve masks in the nurseries. So depending on what you're used to, make sure you have the right size masks. You've checked that your oxygen and suction is working and that is clean. Because you don't want to be, if it's really grubby and it's been maybe never been used on your particular baby and maybe hasn't even been changed, make sure that it's clean. Otherwise, you're introducing bacteria towards this new baby that you're looking after. Those checks are also just as important. And then also you'll be cleaning your space as well as cleaning the touch points of your incubator. They get fingerprints, and even between shifts, the nurse that's coming in afterwards shouldn't really be finding my fingerprint, shouldn't be working and continuing working with my fingerprints all over the incubator. Because if we all just left each other's fingerprints, you know how the incubators get. It does start to look a little bit unsightly, but then with each smudge you're introducing, we all carry different bacteria through our hands. Even if we've washed our hands, if we touch something else, even after we've washed our hands and then touch the incubator, we may find we're introducing something new towards the baby or around the cot side. So let's just be mindful of our cot sides. And I will show you a video of how to check that your flow meters are working correctly as well. Because what is it that we check for when we're checking our flow meters? Who uses flow meters for the bags and masks? Yeah, Angela, you raised your hand.
Yeah, in KGH we use amber bag, valve and mask. Yeah, we have to check the oxygen. You taught us on the other day as well to check whether the mercury ball is moving properly by occluding the oxygen. It should not because it should just stay there, and it should drop off. And then
Yes.
About the mask, it should be correct size mask covering the bridge of the nose and the chin. And when you press the bag, the pop-off valve should pop up, but not when using with the baby, just when you check for it. And the reservoir bag should fill when the oxygen is turned on to ensure the bag is free of any leak or any tear.
Yep, and that's brilliant. So I will show you that video actually on how to do those checks safely. There is a link as well in there about on checking your neopuffs. For those of you that have neopuffs, there is a link for you to check how to safely check your neopuff. If you're not familiar with it, at least it guides you step by step. So this is just an example of the cotside checks. So some of the eagle-eyed people who will have noticed, who would have recognized their own cotside checks. So the first one on the left-hand side, and I apologize, they're not very clear. The one on the left is from Kingsmill. Do you all recognize it? Sian and who else is from Kingsmill? Now. Can't really see. Yes, yeah, you recognize it. And this pretty much is just a checklist that you do every shift. Yeah, Laura, yes. Is it every shift that you check it? You're checking that their NGT competencies are done, your alarm settings have been checked, your medication, and it's just a nice prompt to show you that you've done the checks. Because there are times when you're doing checks, we know what it's like. You may get distracted while you're doing something. So at least while you've done, you know what you've checked. You can probably do like 4 checks, and there's been vomits, there'll wee sometimes, or you might just have them have an explosive poo and it goes all over the sheets. Just take pride in how you leave your babies. It doesn't always just look good, but it's also good for infection prevention, making sure that they have a tidy space. And just be aware of always have infection at the back of your mind when you're doing your day-to-day work. Am I preventing infection in the way that I'm looking after the babies that I've got in my care? So any questions? Okay. Hopefully that was all very clear. I will share this video. So the first one I'll share is the one with this will be the one with the flow meters. I'm going to do that again because it definitely needs sound, and I don't want you not having sound. Okay, just let me know if you could.
From the wall, place 2 fingers on the outer ring and push, and the unit will gently come away. Moving on to testing a low.
Okay, I will stop the video there. Has it brought up anything that people weren't aware of on checking the suction? I know something that I learned, I suppose, when I watched that video is usually when I was checking suction, I'll just check that the needle's going and I can feel the suction on the end of the plug. But as he said, that needle shouldn't move. It should stay. If you've gone to maximum and then reduce the flow, and then the pressure you've gone down to 0. That needle should stay in the place where it was at the beginning. It should stay at the maximum point. So that's something I know I just didn't know on the checks. But I do hope that video has helped you. What I will do is I'll probably send. Oh yes, Megan, yeah, you agree with me. I'll send the other 2 videos and I'll pop them in the group so that you can watch them at your leisure. But I do hope from what we've learned on this session that you're a bit more aware of why induction is important for both families and for staff. And when we know now that when you're familiar with your environment, you're more likely to engage better with your patient's care, and it reduces your anxiety, as well as it will reduce the families, the parents' anxiety as well. Have you noticed that babies as well do pick up on the anxieties of parents? So it, in essence, it actually improves the baby's care because the baby will be calmer as well. They won't be as agitated as well. And then I hope it's giving you a guide into following the cotside process and why it's important to do so. At least then, one, it reassures you that you've done all the things that you need to do, not just ticking the boxes, but then you're giving that full holistic care and you're looking at every aspect of that baby's care while they're in your care in that period of your shift. And then also thinking about infection prevention. So I'm hoping that all these things have come through in the session that you have just had. Any questions before we release you for lunch?